Christin Drake is an assistant attending psychiatrist at New York Presbyterian Hospital. She's also an assistant professor of psychiatry at Weill Cornell Medical College. Thanks for joining us.
Thanks for having me.
In the case of Weinstein, we're seeing more actors slowly come forward with allegations of things that happened decades ago. Psychologically, what's going on there?
It seems that, as more and more people come forward and are able to describe in detail and correctly categorize what happened to them as assault or harassment, that it's probably helpful for people to be able to recognize, what has happened to them, and therefore to come forward.
And so it's easier for them to tell their stories when they see others doing the same.
That's right. That's right. And to know what's going on, there's so much distortion that goes on, in people's minds and outside around these kinds of events. And so to have it discussed and discussed so clearly, it can be helpful both to these women we're hearing from and then to women we're not hearing from.
So when these sexual assault allegations are openly discussed in the media, like in the cases of Bill Cosby, Roger Ailes, does that make it easier for victims who aren't in the spotlight to speak out?
I hope so. The level of detail with which these women are now sharing, their stories, I hope will be helpful, to people.
Is there evidence of that more people sort of come out and tell these stories when they see others doing it publicly?
There's not scientific evidence of it, but it is what we're seeing, lately. And those of us in, the mental health field are seeing more and more people who are seeking treatment, who are recognizing and more able to recognize, that what happened to them was actually assault, was actually harassment.
So what would your advice be to somebody who's watching, who may be a victim of this kind of thing, and they're watching the media coverage? What would your advice to them be?
I would say, another valuable thing that is coming out of this is, real attention to the ways that victims are put off and not helped. And so I'd encourage victims and the people who might be in a position to support them to be aware of that and to be, ready to fight and to push for the validation, for being believed, and for the help that they need.
Dr. Christin Drake, thank you very much for joining us.
Thank you.